Hello, and welcome to our presentation on hemodynamic and lactate response to exhaustive exercise with L-arginine supplementation. My name is Joshua Schutzenhofer. L-arginine is a traditional non-essential amino acid and is commonly known as the precursor to nitric oxide. Existing research on L-arginine discusses the vasodilation of arterioles, clearing of lactic acid, and increased overall blood flow. However, other research also supports that augmented nitric oxide does not improve blood flow with exercise. Nonetheless, research has emerged into L-arginine as an ergogenic aid in healthy populations. Now, the purpose of this study was to examine the effects of exogenous L-arginine supplementation and its potential impact as an ergogenic aid by specifically examining muscle endurance, lactate concentration, and blood flow in healthy population. This study included 12 male subjects, all between the ages of 18 and 25. These subjects were then asked to complete 4 total visits to the lab at Grand Valley State University, with the first visit including completion of both the informed consent and health history questionnaires, recording their resting measures of both heart rate and blood pressure, including their anthropometric measurements such as height, weight, and overall body fat percentage, with visit 1 concluding with a baseline VO2 max test. For visits 2 through 4, the only differences in procedure was obviously the treatment that was administered. Prior to the ingestion of the treatment, blood flow, lactate, mean arterial pressure, and heart rate were all recorded. Now, subjects were then administered one of the 3 treatments in a counterbalanced manner. First one being the control treatment with a taste-matched placebo. Second was a 2-gram dose of L-arginine. Third was the 4-gram dose. 15 minutes post-ingestion of the treatment, the subject's blood flow, lactate, mean arterial pressure, and heart rate were then again recorded just prior to exercise. Subjects then performed the push-up test to volitional fatigue and then had their blood flow, lactate, mean arterial pressure, and heart rate recorded once more at both the 25-minute mark and the 40-minute mark. When it comes to analyzing the data for lactate and blood flow, a repeated measures ANOVA was implemented with a greenhouse geyser correction. Lactate deltas at both the 25 and 40-minute marks utilized a pair samples t-test across conditions when observing lactate clearance post-exercise. Thirdly, heart rate and mean arterial pressure was analyzed with the 3 conditions times the 4 time points repeated measures ANOVA. Finally, muscular endurance utilized the one-way ANOVA for its analysis. Now, results pertaining to lactate clearance. There was no main effect on the treatment. However, as to be expected with anaerobic volitional fatigue exercise, there was a main effect on the time, illustrated by those 25 minutes and 40-minute points. However, it is interesting to note that the clearance of lactate seemed to be enhanced with a higher 4-gram dose of L-arginine when we look at the delta from the 25 to 40-minute standpoints, with the 4-gram dose treatment trending towards significance with a p-value of 0.055. When compared to the placebo and the 2-gram dose treatments, L-arginine's effects on blood flow showed that the higher 4-gram dose displayed an increased blood flow at both the 15-minute mark, which is just prior to exercise, and the 25-minute mark, which is immediately following exhaustive exercise. Now, results pertaining to the muscular endurance, it was shown that there wasn't really a difference between the amount of push-ups that could be done or the amount of push-ups in the specific time frame that was allowed. Now, discussion. The data from this investigation suggests that L-arginine may play a role in the clearance of lactate induced from exercise. Now, this is concurrent with the Schaefer study in 2002 that stated L-arginine reduced exercise-induced lactate in plasma. Now, blood flow is enhanced with the 4 grams of L-arginine as compared to the 2-gram dose and placebo at rest, prior to, and immediately after exhaustive exercise. Studies show that L-arginine has been demonstrated to be a common vasodilator, but counter to other research, we did find that L-arginine enhanced blood flow in individuals void of vascular disorders, so healthy individuals. Now, no significant increase in muscular endurance with L-arginine supplementation. When it comes to limitations of future investigations, population sample size could pose as a limitation as there are only 12 participants, in addition to the fact that standard dosing of treatments was implemented without consideration for subjects' individual mass. Consideration for the future would include topics such as effects of chronic or long-term supplementation of L-arginine, of L-arginine instead of the short-term, in addition to the tracking of the amount of L-citrulline, because as we all know, L-citrullinase is a byproduct of L-arginine breakdown. Another area of study could include L-arginine effects on individuals with vascular disorders or other varying demographics in general. And these are our references. Thank you and have a good day.